There are other patients with symptoms like rectal bleeding, change of bowel habit, passage of blood in the stools, or passage of mucus in the stools, change of stool caliber, diarrhea, constipation, loss of weight, loss of appetite, or even abdominal bloatedness. So for this group of patients that come to see me with all these symptoms, I'll assess them carefully. And some of them even come to me without any symptoms, because they've read about colorectal cancer screening. With colorectal cancer being the most common cancer in Singapore, they're actually obviously very worried about it, and beyond a certain age, they often request to have a colonoscopy done. The introduction of Western influences into our lifestyle in Singapore. I think with that comes a lot of unhealthy lifestyle, including fast food, increase in red meat in our diet, introduction of unhealthy habits such as smoking. All these unhealthy lifestyles can actually contribute to an increase in cancer. Why we are seeing it more and more in young people? Of course, we cannot pinpoint exactly what is the cause, but certainly there's a lot of postulation that it could be related to the unhealthy lifestyle that we have. In fact, it's not uncommon to actually see people in their 40s having cancer. And certainly I've seen a number of patients who are in their 30s as well. And the youngest that I've seen is actually someone in the 20s who actually had colorectal cancer. I think first and foremost, most importantly, starting from the patient themselves. I think increased awareness is very important. As the Singapore population advances, the timeline between the patient seeing me and actually getting the final diagnosis and treatment can be quite quick. For instance, the patient may actually see me with various symptoms, such as rectal bleeding or change of bowel habit. And I would actually be able to do the colonoscope for the patient within the same day. And thereafter, once the diagnosis is made, usually it takes about a day for the result to return. And usually before the actual treatment in terms of surgery, various scans will have to be done for this group of patients, and again that can be done within the day. For instance, there could be a very early stage tumor where the lymph nodes are not affected. Unless there are other specific high risk factors, most of these patients actually do not require any further treatment in the form of chemotherapy or radiotherapy. Whereas in other cases where the lymph nodes are actually affected, then it's actually a more advanced cancer where the risk of recurrence is higher. And in this group of patients, we generally strongly consider the option of chemotherapy. I think most of the time when there's a cancer, surgery is needed. And surgery can be in both open surgery as well as minimally invasive laparoscopic surgery or even robotic surgery. After surgery, there are of course a whole host of complications that can arise. Although the vast majority of patients, more than 90%, will actually get through surgery without any problems, in the minority of cases, there can be potential complications. And of course, if any complications arise, and if they are severe, that can potentially lead to a prolonged stay in hospital with, perhaps even intensive care stay, which will lead to escalating costs, and that can be a source of stress to both the patients as well as the medical team looking after the patients as well. Colorectal cancer usually do not happen overnight. It goes through a series of mutations, and usually it starts off by forming a small polyp, becoming a more advanced polyp, late polyp before turning into cancer. This whole process takes about 8 to 10 years. Patients are becoming more and more knowledgeable. And with increased knowledge, they actually seek help earlier, which is good because when we actually detect cancer at the earlier stages, the chance of cure is much better. And they are not always ready to listen to the treatment first time round. Tell a layperson that they've got cancer, even though to me I see it very often, and I do know for a fact that a lot of colorectal cancer cases, when you detect them early, is actually quite curable.